Good afternoon, everybody from England, and good evening to some of you, good morning to some of you. Welcome to this first session of the afternoon, which is on advocacy and the nursing profession. Advocacy has been a very important component for the Nursing Now campaign. It's really what we're all about. We're trying to raise the status and profile of nurses in order to improve healthcare. So to do that, we have to become effective advocates for the nursing profession, which includes using the evidence that we have and also trying to influence what politicians do and what governments do to invest in nursing. So we've assembled a fabulous panel to talk this afternoon about efforts in advocacy and why they think it's important for nursing. You can find everybody's bios on our conference site. So I encourage you, if you want to know more about anybody who's talking, please do go and look at those bios. Our sessions are quite short. They're only 50 minutes. So we're not going to have long introductions. But I must say how delighted we are to have Erica, Ramnik and Vince with us this afternoon. And Nick, I hope, Nick Bradshaw from Wish, if he gets on, he was having a few technical issues. But you are also welcome, and we're very grateful to you for joining us. Erica, I want to start with you. Erica is the policy advisor, I think, is it, for the ICN, Erica, based in Canada, I think? Is it? Yeah. I'm going to ask you, Erica, to talk us through a bit why advocacy is important and what ICN does to be an effective advocate for nurses, which we know they are. They've done a wonderful job in the pandemic. Over to you.
Absolutely. Thank you so much, Barbara. Hi to everyone. I am speaking from Toronto, Canada. As you know, Geneva is the home of ICN, but I sort of cover the region over here. So Barbara, you're absolutely right. We, as a nursing profession, rely on quite heavily and need effective advocacy. And advocating for the nursing profession is actually at the core of ICN's work, and it has been since its inception, so since 1899. And so I think that where the nursing profession sits right now, as well as all of its collective achievements, is actually the direct result of effective advocacy. And ICN was born, so if you look back into its history, it was born on the intersection of women's rights, social progressivism, and healthcare reform. So all of these things were sort of coming together in this mix. And the nurses who actually founded ICN were very strong advocates for the women's movement at the international level. And so developing organized nursing while fighting for these sort of social and women's rights is really how ICN was first created. When you read back on the history, there's some very interesting stories. One of them being that one of the founders, Lavinia Dock is her name, she was actually a really strong supporter of women's rights. She fought for and advocated for the treatment of venereal disease, or what we today know as STIs. And actually in 1917, she picketed the White House and was jailed 3 times that year for her militant suffrage activities. So if we look at this, we see that this is an example of very early advocacy in the nursing profession and within ICN. And this work has actually carried us from 1899 to present day, where we see nurses as leaders, we see nurse politicians, there's the advanced practice role, we're seeing nurse-led models of care, and nurses really being at the center of interprofessional teams. A couple of examples of really big things that we've achieved recently through effective advocacy is that WHO now has a chief nursing officer. So that's huge. That would not have been, or that was in part certainly for the work of nurses around the world and the work of ICN and its NNA members. Effective Advocacy also supported the decision for the World Health Assembly to vote in favor of making 2020 the year of the nurse and the midwife, which of course we're all in the middle of celebrating right now. And I guess with ICN's work being sort of centered around advocacy, I could, sit here and talk for hours about examples. I'll mention two other examples that are really quite powerful and really show you how far advocacy can take us. We advocate on a number of different issues through a number of different mechanisms. So we're thinking about issues, not only the nursing profession and advancing its role and its image, but also how nurses contribute to global health and to public health issues. So, for example, falsified and counterfeit medicines, attacks and violence on healthcare. As Vince will probably touch on, our organizations, IntraHealth and ICN, have worked collectively in advocating against those attacks on healthcare. So that's a really good example. Mental health, primary healthcare. So these are all the issues that we work on and sort of use these advocacy strategies around. Again, I'll point out two important pieces of ICN work that exemplify this. So one being the International Nurses Day. This day has a corresponding resource or set of resources. And one of the main reasons why IND is so effective is because it really employs important advocacy strategies. And one of those being connecting with stories. So at the heart of advocacy is sort of connecting with that human-to-human level and being able to leverage that. So actually, Florence Nightingale, for example, did exactly this. And nurses today are in such a good place because we transform those stories into policies, which then advance the profession. And so over the last 3 years, ICN has really incorporated these case studies into the IND resource, and we've seen immense success with how people are connecting and how they're using it to advance, whether it's at the clinic level or up in politics. And so from these insights from fellow nurses around the world comes the power for change, really. Another example of ICN's advocacy is our president's work on UN and WHO commissions. So 2 ICN presidents have actually been commissioners for high-level commissions. The first was Judith Shamian, who contributed to the nursing voice at the UN or the United Nations Commission for Health, Employment, and Economic Growth. A mouthful. And that commission actually made a really compelling case for investment in the workforce. And the second is our current president, Annette Kennedy, and she contributed to the WHO Independent High-Level Commission on Non-Communicable Diseases, and just showing to the world and to all of the healthcare professionals and other stakeholders outside of the healthcare sector, really the vital role that nurses play in NCDs and mental health services. So those are some examples of advocacy and sort of the roots that advocacy can take and the power that it has. I'll stop there for this part of the question. Yeah.
Thank you so much, Erica. And you've really drawn our attention to the importance of international level advocacy with, thinking about those commissions and the work that ICN presidents have done and why it is critical that, nursing has a seat at these tables where these high level conversations are going on, and actually that it doesn't happen all the time. You really have to make a case for it and know people who can help you get there. So that's really important messages. Sorry, go ahead.
I do have some, I can share some insight, sort of how we can all become advocates in our profession. I think that nurses are really already on their way to becoming strong advocates. As Jean Watson said, effective advocacy is an essential component of the humanistic philosophy of nursing. So if I still have a few minutes, I'll go over sort of a few key ingredients that I think that I've seen both personally and at ICN that are effective for advocacy. And I think that these apply at, you mentioned the political level, but I think that they apply at all levels. So whether it's you're working for a professional organization and that you're at the WHO, or you're at your family dinner surrounded by physicians, and you need to sort of, fight for what you do and who you are, I think that we can take little bits of this and apply it. My first tip would be to understand the issues and look at them from all levels. So Florence Nightingale, again, we can see this in her work because she really understood that suffering came from factors at the systemic level and the societal levels, which at that time was quite advanced. So if you're advocating for fair pay, let's say for nurses, it's helpful to really consider all of the factors that lead to unfair pay. So gender, public perception. And so to really deeply understand the issue that you're advocating for allows you to sort of stand more strongly in the issue. So we know, we're nurses, we love nurses, nurses are great, but why? And so why are we really advocating for this profession? So I must say that it's a process of, gathering knowledge, learning, reading, listening, which I guess brings me to the next point, which is we want to be focused and precise in our advocacy. So again, nurses are great. We all know that, but tell them why. So clearly articulate these issues. And it's really about mobilizing evidence. So know about the evidence and use it to show our impact. And actually, we can see the power of this in the Triple Impact report that the Nursing Now campaign is built on. The report uses very clear evidence and shows clearly when nurses are empowered, health improves, gender equality improves, and economies are strengthened. So as we all know, this report has been an extremely effective advocacy tool. Another example is Linda Aiken's work around safe nurse staffing and levels. To this day, nursing organizations around the world use this evidence to advocate for safe staffing and to improve working conditions and patient outcomes. Just very quickly, I'll also say a couple of more things. You want to gain trust. So I think nursing is very well positioned to already have the trust as one of, consistently ranked one of the most trusted professions around. And advocacy also takes persistence. So another thing that I'll say is that it might be uncomfortable. You might be pushing your boundaries. You might be pushing your comfort level. I actually couldn't think of a better time to talk about the power of advocacy and how important it is for change, because right now the world is facing some really important issues that have really important and powerful advocates behind them. So if we do a quick scan right now in this present day, we can see some really powerful examples of it. So the organizers of the Black Lives Matter network, for example, have had so many successes. And, what is at their core is advocacy. They've done this through relationship building, through building community, strong communities. And so this is really what effective advocacy looks like. I also think that advocacy is powerful in numbers, which is why I know that if we all become advocates, we will succeed in achieving our goals. There are 28 million of us, so how can we not? The ICN president, her watchword is actually together for her presidency. And so Annette actually says that together we really hold the power to influence, to drive change, and to call for action. So building relationships, working together with common goals. We've all heard the phrase one unified voice or speaking with one nursing voice. So messages are absolutely stronger when they're coordinated and when they're collaborative. And a really accessible way, actually, the last thing I'll mention is to have an elevator speech. So if we're looking at how can we all become an advocate, So, maybe I don't have a seat at the World Health Assembly, but what can I do for nursing that, will contribute to this? And so having an elevator speech, you find yourself in an elevator, you have the person with the magic button to blast nursing up to the top. You have 60 seconds before the door opens. What do you say? So I really encourage nurses around the world to develop this. There's lots of different versions, but what you want to do is just be very clear on why you do what you do, and what you do, and why it's important. So never ever get stuck with nothing to say. These moments can absolutely have real impact.
Thanks, Erica. That's great advice. Never get stuck with nothing to say. That is really good advice. And we certainly helped our young nurses last year to create their own elevator speeches, which is a wonderful segue into our next speaker. Thank you, Erica. Our next speaker is Nick Bradshaw. Nick, I'm delighted you've been able to get online. I was slightly concerned you couldn't.
Me too. I hope you can hear me.
Thank you so much. Nick's joining us from Qatar, I think. Are you?
I am.
Yes. Where he works with the Wish Qatar Foundation. And we got to know Nick last year when they supported our young nurses pre-WHA workshop where we met Ramnik. So we're joining all the dots here, and Erica, in fact, who took our young nurses to the assembly. So yeah, it was a really good opportunity to network, as Erica said. Use your networks, use the people you know. So Nick, talk to us a bit about what the Wish Foundation is doing with nursing. You've really upped your game with nursing in recent years, I would say.
Yeah, I hope we have. It's rather wonderful to be with everybody here today. So Wish, it's the World Innovation Summit for Health. We're an initiative of Qatar Foundation. And our job is really, we bring together healthcare leaders, practitioners, researchers, innovators from around the world to form a community that meets every 2 years. We produce reports which are central to those meetings, but year round we try and partner and support with others who are working to build a healthier world, to not wish to sound too corny. And dare I say, if we're honest, I think before our last summit, where we ended up working with Nursing Now and we produced a report on nursing and universal health coverage, we were guilty of focusing on only the caregiving aspects of nursing. We were, that's certainly changed across my organization. It's now a case of how on earth can you develop healthcare policy and systems without having nurses front and center? And within the report, it became really clear that you cannot have UHC without investing in nurses and nursing. Nurses and midwives are all too often undervalued, yet the person-centered and holistic approach to health and to communities makes nurses particularly well suited to leading in the delivery of effective UHC. So for us to advocate for nurses was really easy, really straightforward. For me as an individual to actually end up being with the young nurses last year in Geneva was incredibly inspiring. And for an old man like me, it was that idea of being really energized by seeing the young nurses on the program. And the young nursing leaders I encountered, Ramnik's here, and those I've been interacting with since actually, have been bursting with ideas that need to be heard. So there's still an active WhatsApp group amongst the people, and it's great to see people sharing their ideas and seeing that there's so many commonalities. I think we need more nurses, yes, definitely, but we need more nurses at the top of the healthcare systems, at that top table, both to build better systems and to also inspire others, of course, to join the profession. And I think what I felt from being with the group last year and us within Wish as an organization, we think that mindset has to be there early. And I suppose nurses not only can be healthcare leaders, but given their knowledge, training, compassion, frontline experience, it's not that they can be, it's that they must be. They have to be leaders. And it needs to be the mindset when nurses start their careers, which is why it was great working with young nurses last year, because if you start early with that mindset, that this is part of your toolkit, I suppose, that you're a caregiver, yes, you have the training, the experience, but you're also an advocate for other nurses. And from a wish perspective, if we can be advocates to the wider health community and to society in general, because then you're encouraging people to think of nursing as a profession that is, well, the things that I've learned to know, that, you know, the central role that's played in policy making that we're seeing from ICN, we're seeing from nursing now, then that's a really bold, great future. But I mean, we also think that nurses need to be provided with the tools to speak up, to never be shouted down, to never be ignored, because what you bring to the table is not just important, it's essential. I mean, nurses know this, healthcare sector knows this, I think, increasingly, thanks to things like Nursing Now and the Florence Nightingale initiative, the Nightingale Challenge that's here now. Yeah, I'm just delighted to be here. There's a real energy when you deal with nurses, and it's great to be a part of that.
Nick, thank you so much. It's great to hear that you know, that we are influencing as a professional group. We're having an influence, and people are beginning to see nurses. That nursing is becoming more visible, and I'm sure part of that is the COVID-19 pandemic. But I think it's also true in general.
A change for us, Barbara, has really been whenever we're having panel discussions or we're doing reports or workshops, it's always now, we now ask, what's the nursing perspective there? And if there isn't a nurse representative in that room, it feels like something's missing now. It didn't feel like that before, and it should have done, but it does now, and increasingly does. And it really should be a case of, if there's not a nurse there, then where is the nursing representative? You're missing a key part of this discussion.
That's brilliant, Nick. I hope one of our session admins has captured that thought to tweet it out to our millions of followers. Vince, I want to turn to you. So Vince and I are ex-colleagues. We were colleagues at IntraHealth, and Vince until only a couple of days ago. So we've been working with you, Vince, as head of the Frontline Health Workers Coalition, but you're about to move into something new and exciting. But I know you because I know you as a political advocate, because I actually did a trip on the Hill with you, and we went and visited lots of senators, and we went to the House, and we did, it was one of the most exciting days I've ever had, thanks to Vince. So Vince, I just wanted to ask you to share with us a bit about how important is political advocacy, real political advocacy, and how do we get into it? And should we?
Yeah, sure. I mean, I actually think that it's absolutely central, and nobody is better actually positioned to get involved in political advocacy than nurses who are doing the work day in and day out. But I think a lot of people have trepidation in getting into it because they see it as that it doesn't have this major impact, or that they can't have a major impact on the outcome. But our experience is certainly the opposite. But in order to be effective, you do have to have a few pieces connect. And I think both Erica and Nick talked about this, a little different elements of this. I think the three main pieces are stories, your own story, and that's obviously what you would know the best, and is critically important to illustrate those stories in front of policymakers. But it's combining that story with data and knowing the data that is about the topic that you're talking about. Obviously, us nursing advocates now have a really great new tool with the State of the World's nursing report just having come out a couple of months ago. A lot of I know country by country, there's a lot of really good reports out. Some were already mentioned. Nick was talking about the issue of nursing leadership. One of the areas we felt like was neglected in terms of data and information. So Nursing Now and IntraHealth and Johnson & Johnson did a global survey of nurses last year, and we produced a report on nursing leadership and the gender-related issues kind of hindering the impact of nursing leadership taking a greater position, both the profession of nursing within the health system, and then gender-related issues within the nursing profession. So, so there's your own personal story, and those personal stories were critical to that bigger data piece, and then it's matching that with the policies and the political situation in which you're dealing with. And so the coalition that I have been leading, the Frontline Health Workers Coalition, it started in 2012, and a lot of the big international NGOs working in global health around the world, as well as some health worker associations and advocacy groups came together. And it really was to try to, there's a lot of advocacy happening in Washington to try to impact U.S. foreign assistance on global health around the world and how that works. But there really was not that much within that advocating for the health workers who are delivering those services. So of course, there's billions of dollars going around the world to programs in HIV or malaria or maternal and child health or family planning. And of course, those programs are great, but they're not as impactful if they don't have the perspective of the people who are implementing those programs, which the majority of which are come from nurses. So we really wanted to try to elevate the voices of nurses, midwives, community doctors, community health workers within that policy sphere. And the impact of the last 7.5 years of doing that has been quite amazing. And Erica has touched on some of those. In 2016, the WHO they'd never had a strategy on how governments were supposed to, how governments should create and implement their health workforce plans for their country. So the first ever global health workforce strategy was approved in 2016, called Workforce 2030. There's specific milestones that are set out within that framework that they're supposed to adhere to. We had a lot of health workers advocating at the UN when the Millennium Development Goals, which are global set of goals that everyone's supposed to adhere to, that was winding down, and then the Sustainable Development Goals were coming up, and everybody was there at the UN trying to say we need this goal or that goal. Well, we made sure that there's a goal, a specific target within the health goal for health workforce, and so countries are required now to report on what they're doing and for the health workforce within the SDG framework, and then of course. Some of these commissions and all of that, those commissions don't happen unless there's some advocacy movement behind it. So we're at a really great time in terms of there's been a lot of good things put on paper in some of these frameworks. There's strong movement for health workforce within the universal health coverage movement that was passed last year, but really where the rubber meets the road on some of this is going to be how it's implemented, what type of resources are going to be put forth. And so that's going to happen at each individual country and community. So what I would encourage people to do, and what we try to do with the health workers we've worked with, is within your country or context, understand what the health budget is for the country. Understand what type of programs are being delivered and the politics involved. And a great way to do that is through the Nursing Now group in your country, through the ICN association in your country. But then I would also encourage for nurses not to act alone in that, to ally. I know that there's often there's quite a few issues in terms of how nursing relates to other health workforce professions. I think the best way to assuage those issues is to have continual dialogue with the doctors, with the midwives, and that within your country. And then also to find common ground on how you want to ally together in terms of advocating for the health budget, advocating for not just for wages is obviously very important, but there's so many issues key to your impact and what you need for your work. I think that people often are very also could be an intimidation, and one of the challenges that we've always had in this area is advocating in this area. When you're a student nurse, that's the education ministry involved. When you're talking about some of your protections, that's the labor ministry. The money comes from the finance ministry. The health ministry is administering all the policies that you have and how your health system set up. The gender ministry is going to deal with issues of lack of representation and sexual harassment within the workforce and all of that. So there's many different places you need to go, and you need to tailor different messages to those different places. But there's no group of people that have a greater understanding of how all of those things come together than nurses implementing on the ground. And so I think don't be afraid to share your perspective, to ask questions as to how this relates to the bigger policy issue. And I think in doing that, you can see tangible results both within your community and nationally and globally. I think I'll stop there, Barbara.
Thank you, Vince. You introduced some really critical points. Vince was instrumental, really, in getting the WHO to take more interest in stories. And I recall at the Assembly, we really pushed, didn't we, for
yeah. I can share a quick anecdote on that. Is we really have made the last several years an effort to both train frontline health workers in storytelling, and then matching them up with policymakers. And a few years back, we brought a nurse from that works at the Uganda Heart Institute in Kampala to the World Health Assembly, and she has some really amazing and very difficult stories about certainly heart disease in Uganda. The affordability of some of the interventions is very difficult, and nurses have to take on so much there just to get some of those procedures done. And so she was sharing these stories in a couple of panels that we had got her on, but just bringing her there, then then the health ministers wanted to meet her. Then she started speaking on a podcast that the American consulate in Geneva was putting on for the week. Then we were just walking down the hallway, and we ran into Dr. Tedros, the Director General, and have a photo with her. Those sorts of things then inspire others, and she's brought back the next year without us. She has advocated within her institute with other nurses there to change some of the practices that they were doing, and to involve nurses more. So it's one little bit at a time, and all of that together makes for some a powerful movement.
Oh, that's so true, and that shows the power of stories. And you also mentioned, how important it is to talk to the other professions, to try and do this in a united way instead of dividing. And that's, one of the reasons that we're so delighted to be able to work with WISH and to hear what Nick is saying. Now it's important to bring nurses in to that multi-professional arena so that all the voices are heard. So thank you so much. And I'm now going to ask Ramnik, one of our stars from the Pre-World Health Assembly workshop. And Ramnik's from the Philippines and has been absolutely, since he went on that workshop, I'd love to say, Ramnik, it was because of the workshop, but I'm quite sure that you have a lot of these qualities long before you came to us. But I'd love for you to talk to a bit about, because you went back on your own to the Philippines and you succeeded in engaging public and private hospitals in the Laguna province. And you got thousands of nurses, or maybe it was hundreds of nurses, onto the Nightingale Challenge, but you were extraordinary all by yourself. So what gave you the motivation? Well, how did you do it? Tell us how you did it and motivate us to be leaders.
Thank you, Barbara. Well, prior to the launching of the Nightingale Challenge, we have established a network. That is one of the powerful tools that I learned in the Pre-World Health Assembly last year. And in my case, I reached out my province and the nurse executives of public and private hospitals to join my advocacy. So I need to influence them, all of them. And there is always a challenge and all on the way. And you should never stop. So that's one point that I learned. You should reach more. So I reached the regional up to the national level of the National Nursing Association. And it is important for nurses to work together across settings and roles to advocate on behalf of colleagues and the profession. We need to expand our advocacy and we need to for senior nurses, and realize that we are the stewards of our profession. You should be their model and mentor. Let them speak out and hear their ideas and concerns. Support them and show them that we are investing for nurses, allocate budget, and continue their education. For the local and national government, I believe that it's the time for us to give scholarships for students who want to pursue nursing. This investment will ensure the future of the healthcare system and will provide sustainability to the most critical healthcare professional in a country. I believe that some of the challenges are retention of nurses, work environment, budget allocation, mind the healthcare system force. When nurses are satisfied with their results, they're more likely to contribute additional years of service, expertise, and nursing workforce. At present, I'm coordinating with the National Nursing Association and the Association of the Nursing Service Administrators because we are planning earlier this year. I have a meeting with them, and then we are planning to have a certifying course for those young nurses under the Nightingale Challenge. But I'm lucky because Ms. Harry has coordinated with the DOH, Department of Health of the Philippines, and some colleagues, and we are trying to establish actually online partners to be included for all nurses, especially the young nurses. I believe that it's the time that you do not be afraid to explore opportunities to improve profession. All our voices are equally important in shaping our profession, and all of us. Thank you.
Thank you, Ramnik. You were slightly breaking up, but I think we got most of it there. I picked out particularly the importance of the work environment and budgets, which also came up in the politics of nursing.
Yes,
you need to be able to do a good job. But I think what you've shown us, Ramnik, is the power of one. I mean, I know together we are more powerful, but you are the power of one. You went back with a determination and a vision to do something, and you did it. Was it difficult, Ramnik?
Yes. Well, it's challenging to influence all the nurse executives. Most of them are all seniors, and this is actually a new program, a new idea to be included in the present program of the nursing workforce. So I need to have that perseverance to continue explaining and then advocating that this the technical challenge will have a big impact on the present nursing workforce of their facility. So as of now, when I try to talk to them and consult to them, so they have that positive view regarding the Nightingale Challenge, because they are starting to experience that well in retention of their staff. There's a big retention of nursing personnel in some of the facilities here in our province. So because they have that open the investment when it comes to the workforce. So then they are following their own program, the Nightingale Challenge. And what they want me to do is actually coordinate and let this be heard not only in the province, also nationwide. So I'm doing this right now, coordinating to the national level. I want to have the Nightingale Challenge to be included as a program of the Philippines in the International Year of the Nurse and the Midwife.
Fantastic, Ramnik. And there are some of your fellow country people on this webinar as well. So we're seeing them in the chat here. So I think you're going to get a group who's going to be supporting you. This is a big chance to bring people together, which is what Nursing Now loves to do. Erica, I'm going to turn to you once more. There's been a bit of correspondence in the chat about the report on safeguarding health workers, which of course is critically important and beyond belief, really, some of the things that happen to health workers because they're health workers. And I know you've been involved in compiling a report about that. Talk to us a bit about how you influence something as difficult as keeping health workers safe, because the stakeholder base in that is actually huge, isn't it? Goes, you know, it's national, international, and and also to do with the people that perpetrate these dreadful things. How do you go about that?
Yeah. So absolutely. So just for a little bit of background, ICN is part of the Safeguarding Health and Conflict Coalition, which is a group of healthcare organizations that have come together to protect healthcare and healthcare workers in conflict settings. And so this year, the report, we release an annual report that looks at, in the previous year, all of the attacks on healthcare or violence against healthcare and healthcare workers. So it looks at attacks on healthcare workers. It looks at attacks or violence against facilities, against transportation, and you're absolutely right. It is a huge issue with lots of politics involved and lots of moving pieces. And I think the report has been really successful in that it doesn't hold back. And when I first joined the group as representative for ICN on the steering committee, I think that is what struck me most, is that this group persevered and was very honest. So a lot of transparency. And I say that, and I'm specifically referring to, sort of the calling out of perpetrators. And I think that sometimes in advocacy, you have to be really bold and you can't hold back. And this is very true when people are losing their lives. Health and healthcare in war and conflict was and is sacred, and for many years wasn't touched. And so what we're seeing in the world is that it's now any, you know, the IHR is being ignored, and people are using this as a tactic. This is really important for nurses because we are bound by our ethical code to give unbiased care to whomever needs care. And so the ability to do that also rests on having you know, these big concepts respected, and one of them being you know, stop attacking healthcare. So I think that the report is also successful because it's both honest and transparent, and it shows data. So it's a really strong report for data, and calling out the perpetrators and listing the numbers. So this many attacks have happened. This is how many nurses have died. This is how many physicians have died. And so really just very clearly spelling it out. Because if you position it as just sort of, oh, this is an issue, I think that really how that translates on the ground is missed. So I think the report does a really good job, and the coalition does a really good job of humanizing the issue, and of really showing, you know, individual accounts of these violent acts, and, you know, this is who did it, this is who it affected, and so it makes a very strong call that policymakers in all sectors can't really avoid.
And Barbara, I'll add that the result of that work, of the stories and the data, like, was the WHO had not been reporting on these attacks, and now is. There's challenges with that reporting, and there's more advocacy to do there, but they are now reporting on those attacks, and then also there's a UN Security Council resolution. Mm-hmm. It's still a massive issue, but there's been direct, tangible, you know, results from that bold advocacy that Erica is talking about.
That's fantastic, and I think it really highlights the importance of, well, what they used to say, well, you know, how do I get to Carnegie Hall? Practice, practice, practice. You really have to get your ducks in a row, don't you, if you're going to make an advocacy case? And Nick, you know, I must have used the WISH report on UHC 1,000 times as evidence, you know. It's, I mean, that's exactly the compilation of evidence that we need to say that nursing is effective and cost effective, which is what politicians listen to. As soon as you say cost, they're all ears. So, you know, it's a cost effective way, for example, of dealing with non-communicable diseases, which is why Annette's presence on the NCD Commission, Annette Kennedy, was so vital. So collecting this evidence, I think, is critical. But what I think nursing has not been, I mean, we must have so much evidence about the effectiveness of nursing practice. We could build a house with it if it was made into bricks. But what we're not very good at is getting the stories to be attractive to people who aren't nurses. So have any of you got any tips about how do we do that? How do we get people to stop and think, oh, this is interesting, I should listen to this? What captures the interests of policymakers and politicians? Erica, let me go to you first.
Yeah. I'll say just quickly, I mean, I think it's, again, as I mentioned earlier, it's knowing your audience. So knowing who you're speaking to. So as Vince said, you know, whether it's the health sector, whether it's finance, whether it's education, knowing a little bit about who your audience is will allow you to sort of find what's important to them and speak in their language. So I think that's what, as well, the UN Commission on Health, Employment, and Economic Growth did so well, is that finally we were able, the health sector was able to speak in economic terms, in economic language. And so then those folks who are outside of health stop and say, oh, well, this is in my language, so now I understand. And it's making those links from what you know so well to what others know so well, and linking those two. And I think that that's really important.
So know your audience. That's very important, isn't it? Nick?
I was just going to say, I think when we're talking about young people, which have been the focus of where we've been looking, there's a confidence, there's an optimism, there's an energy that comes with youth, and you have to make sure those aren't lost. People have mentioned, I think Vince and Erica and Ramnik as well, have all mentioned about the importance of the story, having evidence-based, having that fact, but there's something about practicing from an early age, having that confidence, dressing up, wearing the suit, going into that meeting and feeling, I have a right to be here and put my case forward. And if you can start doing that from an early age, that experience really builds things for you. I think we have found that doing workshops with people, not around nursing at all, but around empowerment, about how to present yourself, how to present your story, just means that when you go into that room, then you are going to shock those people probably with the facts that you have, because those facts are strong. Your stories are strong, and really hard for somebody to look somebody in the eye in a different field. You look at someone like Greta Thunberg in climate change. Very hard to say, no, we're not going to bother with you, because she has the strong evidence, the strong facts, but she has youth as well. And talking about people's future, when those young people are talking themselves, it's very hard to walk away from that.
That's it's so interesting, Nick, and you're so right. I mean, Greta Thunberg is absolutely compelling. So, Ramnik, is it your youthful enthusiasm that gets people to join your quest? What do you think? Are you on mute, Ramnik? Can't hear you. Am I the only one who can't hear? Can anybody hear Ramnik?
No.
No. Try again, Ramnik. No, can't hear you. I think it must be the internet. Don't worry. But Ramnik, take a look in the chat. There's lots of chat remarks for you to look at. Vince, I'm just going to ask you,
Sure.
Round us off. What do we need to do?
Yeah, sure. I mean, I think that it's obviously different in every political context, but all politicians, policymakers have areas that can motivate them, and obviously, and making them aware of that, and also doing your own background as to what motivates politicians and what they need in their what the policy is in their local constituency is important. Letting them know that nurses vote, nurses have impact on the economy, nurses have impact on the health outcomes of their constituency. All of those things, that it's very important to make it very as direct and concrete for the issue that you're talking about having impact on what they care about. And so that doing that and coming with the stories and the evidence is great, but matching that in a very clear, concise way that will directly motivate them into something they care about. That's the most likely success that you can have, I think.
Fantastic. What a way to end. So know your audience, know what interests them, and make your story have a hook that captures their interest, and you can then go on to tell them what you need them to know. I want to thank our wonderful panelists. Thank you so much. It's been a great and very fast discussion. We could have done with 2 hours, 2 sets of 50 minutes, but it's been fantastic. Please look in the chat section. There's lots of remarks from people. People have obviously enjoyed this session. We've had more than 100 people on it. So thank you so much. And we'll see you later. Enjoy the rest of your day, everybody. Bye-bye.
Bye.
Bye.